And welcome back to The Factor Uncensored. This next story has doctors across the country scratching their damn heads. More children are being diagnosed with hepatitis. Here's more background on those mysterious infections that we're seeing.
So, Dr. Ali, we've been hearing about a rise in hepatitis cases in children. Before we begin, exactly lay it out. What is hepatitis, first of all?
Isaiah, hepatitis is an inflammation of the liver. We know that there are certain infections, there are certain immune disorders or autoimmune disorders that can cause this inflammation of the liver. However, recently, Isaiah, what we've seen is a significant increase in the number of cases of hepatitis or inflammation of the liver in children.
Now, why is that so unusual? Because I've never actually heard of hepatitis in children before, but why is it unusual?
That's correct, Isaiah, and that's what's currently being researched right now. What we are seeing is an increase in a correlation between adenovirus, specifically type 41, and its relationship to hepatitis. Adenovirus is a virus that folks often get. They're a lot older in population, and they get symptoms such as abdominal pain, a lot of respiratory symptoms, and also like nausea, vomiting, and diarrhea. However, recently, the cases of the adenovirus and its correlation with the hepatitis, we've seen an increase in those. And so though there's not a direct relationship that has been built, we're seeing in these kids, their median age is around 2 years of age. Those are the kids that are being affected with this virus, and we're seeing that it's inflamed the actual liver itself.
Now, when we see hepatitis in adults, how do they typically get it?
So in adults, a lot of times it's related to autoimmune disorders. It's related to toxins such as alcohol. One of the most common things we see is fatty liver or a inflammation of the liver, and sometimes it can be correlated to consumption of alcohol. There are also medications that can also cause it. And so there are different reasons, Isaiah. However, the most common one that we're seeing a correlation potentially with is currently in these kids, in these children, is this adenovirus.
Now, how would you know if your child has been stricken with hepatitis? What signs should you look for?
Isaiah, the signs are very vague. However, one of the things that's most commonly presenting is abdominal pain, specifically right upper quadrant abdominal pain. We also see yellowing of the skin, just like we see with folks that have adult hepatitis. We see folks that have yellowing of the skin or whitening of the eyes. And so those are some things: nausea, vomiting, abdominal pain, fever, chills. Those are all kind of symptoms that we can see with this hepatitis in these children.
And what's the urgency of getting them treated or getting them to the pediatrician once you realize there could be a sign of hepatitis there?
Isaiah, there's a very strong reason and a strong consideration to do that. We have seen that 90% of those folks who have developed hepatitis in these children, again, we have over 350 cases worldwide right now, 150 in this country alone. 90% of them, over 90% have had to have been hospitalized. 15% of those have actually needed a liver transplant.
Wow, wow.
And 5 of those have actually died as well on top of that, Isaiah.
So it's important that you get this checked out if you feel like your child has it. Well, Dr. Ali, before we let you go, we wanted to say happy birthday to you. You celebrated your birthday this weekend by giving back to the community in Waller County, Hempstead specifically. We have some pictures and some video of you out there in action with your free health clinic that you provided for the community. And this is not a first for you. We know you go to Pakistan and you've done it there year after year. Why is it so important for you to give back like this?
Isaiah, I feel that we're all sent down here for a purpose. We all have a special, unique something that's been given to us. You obviously have your own show, which is great, and it's very helpful the way you reach out to your community and to your members. I want to do the same from a health standpoint. And so every year we try to do something like this, and what a better day on the day of your birth where you can celebrate and give back, and rather spending money on things, you can help contribute in that way and give back to society and do these sorts of things. And so that's my goal. I hope to make it an ongoing goal that I continue to work for. And I'm just grateful for all the opportunity. I want to thank all the folks that helped me in this as well, especially thanks to Fox TV and Compass, UMMC. All of those folks were very instrumental in helping me organize this, as well as all the volunteers that came together.
And don't forget about Judge Trey Duhan from Waller County, and also all of your people from Arch Point Pain Institute. And of course, I was out there in the heat sweating with you, but it was well worth it. And once again, happy birthday. And we appreciate you here on The Factor Uncensored, sir.
Thank you so much, Isaiah.